We've known for many years now that our survival rates from cancer in the UK are not as good as some other countries we choose to compare ourselves with across the world. And what we've sought to do over the last 7 or 8 years is to really get under the skin of that. Firstly, to just be sure that those numbers were right. Do we indeed have a survival deficit or don't we? But then, as I say, to get under the skin of those numbers and to figure out what was driving those differences and what particular contribution late diagnosis was making to those differences, because we had a very strong hypothesis all the way along that a big contributor to that deficit in survival rates was a later stage at diagnosis on average in the UK as compared with other countries. So first of all, we did indeed confirm that those survival deficits are real. We compared with countries that have very similar health systems to the health system we have in the UK, and where we really can very strongly believe the data that underpins those comparisons. But then secondly, we took a very systematic approach to figuring out, well, what is it that's causing those differences? And sure enough, late diagnosis is a particular problem, and it's particularly focused in a number of different areas, not in all of the areas we first thought might be an issue, but indeed what's largely driven by what you might call the health system factors. So the speed with which a patient might or might not go and see their doctor if they have symptoms, and that's as much about being worried about wasting the doctor's time, through to how quickly GPs then go on to refer for a test if they're worried that something might be cancer, which might or might not be reflected in their attitudes. It might be about the capacity to do that testing in the system. And so what we've done is, as I say, we've systematically looked across the entire pathway to understand what was causing those differences, and now what we can do as a result is to say, okay, this is how we can improve the situation, how we can diagnose more cancers earlier, and how we can therefore improve our survival rates. So at the same time, one of the other jobs I've had is leading the government and the NHS's work on establishing a new cancer strategy. And a big part of what we've done in that strategy, which was published this summer, was to pick up these findings that we've generated over the last 7 or 8 years and to start to say, okay, this is what we need to do as a result. So for example, a critical focus going forward will be how we increase our diagnostic capacity across the country, how we get more radiologists, how we get more CT scanners and MRI scanners, but also how we get GPs referring more quickly if a patient presents with symptoms. We also have a much greater level of focus, for example, on patients presenting as an emergency, because we know that if a patient is only diagnosed as a result of an emergency presentation, their prognosis is much worse. So really, by shining a light on that issue, we can address the factors that are leading to that, and therefore as a result improve that situation. And then a third example would be what we've called the Be Clear on Cancer campaigns, which encourage patients to go and see their doctor if they have a symptom. So if you like, getting over this problem that we uncovered, which is patients are worried about wasting the doctor's time. So these are 3 examples of a whole menu of things that we're now doing to address the various conclusions we've reached with the data we've generated over the last several years.